Hi, my name is Dr. Dulcie. I'm a clinical and radiation oncologist, and today we want to talk about certain myths about cancer. So myth number one is cancer a death sentence. Many people, when they hear the word cancer, the C word, they equal it to dying. When we look at advancements that have been made since the 1990s and where we are today, there's been a lot of change. What change am I talking about? Previously, the mortality rate, the deaths from cancer were very high, but there have been so many advancements in the terms of treatment, be it the chemotherapy, the targeted therapy, the imaging modalities. Everything has improved. So cancer is not a death sentence. The survival or recovery rates are very high. So being diagnosed with cancer is not a death sentence. The second myth we want to discuss is if no one in my family has had cancer, I am not at risk of getting cancer. That is a myth. It is not true. Recent data has shown that 40% of all men and women are at risk of getting cancer at some point in their life. Remember, cancer can occur because of a genetic mutation that can happen throughout a person's lifetime at any point during life. It can be affected by other things such as the diet you take, the alcohol intake, cigarette smoking, lack of exercise, what you eat, exposure to radiation. So not having a family member having cancer does not mean you're not at risk. Get screened for cancer today because irrespective of your family history, you could be at risk of cancer. So myth number 3 is cancer contagious? Can it be transmitted from one person to the other? Can it be sexually transmitted? So one, cancer is not a contagious disease. You cannot get it by associating by the person. You cannot get cancer by actually being with someone with cancer or close association. The only point where research has shown that there is a risk is when you have organ transplant. So research has shown 2 out of 10,000 organ donations, there could be a risk of cancer being transmitted from one person to the other. So how do doctors avoid that? They generally avoid getting an organ from someone who has had the risk or has a history of having cancer. That's how we cope with that. Remember, there's some viruses that have been known to cause cancer. For example, human papilloma virus. So if you have sexual intercourse with someone with human papilloma virus, you can get the virus, not the cancer necessarily, but exposure to that virus can predispose you to getting cancer. Another virus bacteria we can talk about is H. pylori, Helicobacter pylori. That is a bacteria that normally colonizes the gut. You get hyperacidity, signs and symptoms of gastritis, having heartburn, abdominal bloating. Those are some of the side effects. So what do we do in case you have H. pylori? Because we know it's been implicated in some of the cancers of the stomach. So what do we recommend? Get treated for H. pylori. When you're treated, finish the dose. The treatment is about 14 days and sometimes longer depending on whether the bacteria is cleared or not. So kindly finish your treatment. But is it contagious? If I have cancer, should you worry that you'd get cancer by associating with me? Not quite. So what's the myth number 4? Myth number 4 is having surgery or having a biopsy will make the cancer spread. So what is a biopsy? So if you have a lump, some tumor, a growth within a part of your body, let's take for example in your breast, there is a growth. What a doctor would recommend is a core needle biopsy, where a needle is put through to the tumor and a small piece of that tumor, several cores are taken so that the pathologist can look at it under the microscope and know what kind of breast cancer does the patient have. Is it even cancer to begin with, or is it something that's non-cancerous? So for an oncologist or a doctor who treats cancer to know how to treat you, they must know what kind of cancer do you have. Meaning a small piece must be taken as a biopsy, which can be done using a needle, core needle biopsy. It removes a small core, or surgery, meaning an operation is done, either to remove the tumor in totality or a piece of it. It does not cause cancer to spread. It is done by professionals that have been trained and understand cancer care. So when it is done right by the professionals, then it is carried out in a way that will not cause the cancer to spread. The aim is to know which tumor do we have so that we can be able to know how to treat. So my advice is make sure the biopsy is done by a qualified professional so that it is done correctly, so that it reduces the chances of it to spread. but just doing a biopsy does not guarantee cancer to spread. So if you have a lump, don't be scared. Get a biopsy done. Let us know, is it cancerous or non-cancerous? And if it is cancerous, which type? So that we can know the exact drug that will be able to help and cure you of your cancer. So now we want to talk about myth number 5. Number 5. If a family member has cancer, I am at high risk of getting cancer. That's a myth. Just having a family member does not put you at high risk of getting cancer. Research has shown only 5 to 10% of cancers are inheritable. That means we have 90 to 95% of cancers that do not have any relationship with inheritance. No relationship with any of your family member having cancer. So how do they come about? It can be a multifactorial. Many things can be involved. For example, cigarette smoking, alcohol, exposure to radiation. Even age is also a risk factor that can put you at risk of getting cancer, but not just the fact that your family member has cancer. We do know of the 5 to 10% of cancers that are inheritable, there are many things we can do to prevent or put the family at high surveillance based on that. So having said the fact that having a family member does not put you at high risk, does not neutralize the need to have genetic screening. Genetic screening can help you know whether you have a high risk of getting cancer. Case in point, we have a famous Hollywood actress, Angelina Jolie, who went through cancer screening and was able to know she has a genetic mutation, something in her genes that put her at risk of certain cancers. And based on that, she underwent a series of surgeries to prevent her from getting those cancers. So, does it mean that having a family member puts you at high risk? Not necessarily. Is there a role for genetic screening? Yes.